Everyone, how are you guys doing? I'm Dr. Banu Teja Reddy, consultant urologist, microsurgical andrologist, and robotic surgeon at Continental hospitals. Today, we are going to address a topic that affects millions of us but is often ignored until it's too late. That is urological health and the silent symptoms of urological issues. We are also going to discuss briefly about the early detection and prevention of these urological issues. So, our urinary system plays a very vital role in maintaining the overall health, but when something goes wrong, the signs are often subtle and easy to overlook. So, let's dive into what you need to know to spot these symptoms early and why early detection is very critical, and how you can take steps to prevent these serious complications. So, first, what do you mean by urological issues? So, urological issues are those symptoms or diseases related to kidneys, bladder, ureters are the tubes which connect the kidneys to the bladder, and prostate in men. So, what are the common problems? Common problems include urinary tract infections. Often dismissed as minor, these can cause severe complications and damage your kidneys when ignored. Kidney stones is another common problem, which these kidney stones also can cause infections as well as block the kidneys. Prostate issues like enlargement of prostate or prostate cancer are commonly seen in men over 50 years of age. Bladder issues like difficulty in passing urine, urine leakage like incontinence, overactive bladder, or passing urine in the night times. These are all some bladder issues which we commonly see. Along with that, chronic kidney disease. This is a silent disease which can progress unnoticeably. So, what are the red flags to watch for these urological diseases? So, any pain while urination or blood in the urine, even though small quantities, should not be neglected. Any pain in the abdomen, pain in the flanks or low backache, any weakening of urine stream or thinning of urine stream compared to the previous urine flow, any uh, symptoms related to the bladder like increased nighttime urination or urine leakage without the control, these have to be watched for. And persistent fatigue, swelling of the legs, persistently elevated blood pressure should be watched for. So, why early detection matters? Because early detection, there is a saying called uh, stitch in 9 saves time. So, early detection can prevent many complications like kidney damage or failure, infections that can damage the urinary system or bladder, prostate cancer, if detected early, can be curable, and if it's advanced, then you will need it becomes life threatening, as well as permanent damage to the other organs of the body when the infection spreads. All these are the complications which can be detected, which can be prevented by early detection of urological signs or symptoms. So, regular routine checkups with the urologist, getting a simple examination done by a urologist, simple urine examination, ultrasound of the abdomen and the kidneys, bladder, as well as a simple blood prostate specific antigen test will help us detect these diseases early and treat accordingly. So, what are the prevention tips which I wanted to give? So, the main important ones are staying hydrated is very important. You need to drink at least around 3 to 4 liters of water every single day. This will help to flush out all the toxins in the body and maintain your kidneys and bladder health. Second thing is diet definitely matters. Having fruits, vegetables, whole grains in your daily diet, and reducing the amount of salt and processed food will definitely help you. Having a healthy lifestyle habits like quitting smoking and very limited alcohol consumption uh, helps your kidneys to be healthy, as well as exercising regularly, at least for a period of 45 minutes to 1 hour, will definitely help your kidneys and your urinary health. And if you find out to have any of these unusual symptoms, immediately visit a urologist and get yourself checked. So this will uh, help you in the long run and save your kidneys as well as the urinary system. So unfortunately, many people, usually especially men, hesitate to talk about their urological health due to embarrassment. But remember, your health is nothing to be ashamed of. Early detection saves lives. So seeking help is a sign of strength but not weakness. So now let us see the questions which are put in the chat box one by one. So, okay, here is one question which says, what are the early signs of urological problems that should never be ignored? So, as I've already mentioned, the early signs of urological problems are uh, any blood in the urine, any flank pain, any abdominal pain, any lower abdominal pain, any low backache, any thinning of the urine stream compared to what you were passing before, any swelling in the legs, fatigue. Uh, uh, these are all the common early signs which should never be ignored. And when you are having any of these, definitely you should see a urologist nearby you. So let's go to the next question. So the next question says, how does drinking enough water impact your kidneys and bladder health? Yeah, drinking around 4 to 5 liters of water definitely uh, keeps you hydrated. It flushes out all the toxins and the infective material in your kidneys and prevents kidney stones. So this is how keeping yourself hydrated helps your kidneys and bladder. So the next question is the color of urine detect any health issues? Yeah, definitely. So the normal urine color should be uh, clear, transparent, or pale yellow. So if you are getting little darker urine like brownish urine or so, that means that you are dehydrated. You need to drink in more. You need to drink more water. And if you detect anything to be red, so that means there is some blood going in your urine and you need to immediately see a urologist and get yourself checked. So color definitely does matter. So it's a very important observation to have in your day-to-day life. So let's go for the next question. What are the common causes of urinary tract infections? Yes, the common causes of urinary tract infections are holding urine for much longer time, especially our Indian women, because of various social causes, they tend to hold their urination. So this will cause a lot of toxins and bacteria to grow inside the bladder and or the urinary system and causes urine infections. So other common causes include constipation, kidney stones, any urine catheterization, which is done in hospitals, which if done in a sterile manner, it should not cause any urine infections. But if you don't take proper precautions while catheterization, yes, that's a very common cause for urinary infection. So let's go to the next question. So that is blood in the urine always a serious concern? So it depends on age as well. Usually, blood in the urine is a serious symptom, but if you're of a young age, if you are exercising a lot, so there is a condition called myoglobinuria where the muscle breaks down after a heavy gym activity and then tends to be seen as blood in the urine. So that is when you need not be worried. But or else, if you're above 50 years, if you're a smoker, if you see blood in the urine, then definitely that's very alarming symptom. That's when you should immediately go to a urologist and then get yourself checked. So the next question is, what are the common sanitization concerns women should take care of? Yeah, so women should take care of, that's what, not holding urine for a longer time. Always, when they should have a proper genital hygiene, whenever they are cleaning their genitalia, they should always wipe from above downwards, but not from below upwards. Because if you wipe from below upwards, there can be some bacteria which can be present around your anal opening, which can get deposited into your urethra and cause urine infection. So always remember, you should wipe above downwards. Other than these, you don't need any special antibacterial or anti-fungal washes to be used on a regular basis. So let's go to the next question. How do lifestyle habits like alcohol or smoking affect urological health? Yeah. So smoking, as you all know, definitely causes cancer. Smoking causes kidney cancers, bladder cancers, prostate cancers. So definitely smoking should be quit. And alcohol in limited quantities is okay, but excessive consumption of alcohol also affects your bladder. It tends to cause overactive bladder. When the bladder loses its function, your urine starts leaking without your control. That's called urinary incontinence. So all these things pop up when you are habituated to smoking or alcohol. So the next question is, are urinary problems linked to other health conditions like diabetes or high blood pressure? So, chronic kidney disease is one condition which is caused by diabetes or high blood pressure. That's called diabetic nephropathy or hypertensive nephropathy medically. So, uncontrolled sugar levels or blood pressure levels tend to affect your kidneys function. And if you have if you are persistingly having high blood pressure, you should definitely get yourself checked for your kidney function immediately. So definitely diabetes and high blood pressure do have an impact on urinary system. Diabetes also has an impact on the bladder. So long-standing diabetics and uncontrolled diabetics, the bladder tends to lose the function. The muscle function of the bladder tends to be lost, and they tend to leak urine, or they tend to pass urine more number of times. There'll be increased frequency of urination. They won't get that pressure of urination which they used to get before. So it's very important to keep a control of your diabetes as well as hypertension. So the next question, why does a patient have vaginal discharge after catheter removal? So a patient should not have a vaginal discharge after catheter removal particularly. Both of them are not directly correlated as such. But there can be some discharge from the catheter itself, from the urethra and all. They're all the natural secretions. And sometimes if you find something which is very whitish in the catheter when the catheter is there, that is infection. That could be infection. Then you need to get yourself checked if there is any urinary infection happening. But usually, vaginal discharge after a catheter removal is unlikely. So let's go for the next question. So the next question is, what can I do to prevent kidney stones? So kidney stones are a very common condition which we see in our regular outpatient department. So drinking plenty of water, at least 3 to 4 liters of water every single day, is a very important measure to prevent kidney stones. Some other important measures which have to be taken is avoiding oxalate-rich foods like spinach, chocolates, nuts. They all have a tendency to cause increased stone formation. Reduce the meat consumption. You can have seafood more than the chicken or mutton, which is consumed mostly in this part of the country. Uh, and other measures like mm, having a low salt diet, that's also very important. Avoiding processed foods, all these will help to prevent kidney stone formation. So there is a next question which says, can certain food or drinks irritate the bladder? Yes, as I've just told, alcohol definitely irritates the bladder. So definitely alcohol consumption should be very, very limited. And again, high consumption of caffeine also affects the bladder health. You tend to develop overactive bladder if you consume caffeine more number of times in a day. Can limit your caffeine intake to once or maximum twice a day. Spicy foods also affects bladder health, so avoid spicy foods. Spicy foods taken in a long run also can predispose to overactive bladder or urinary incontinence. So all these food habits or drinking habits can change or maintain your bladder health. So let's go to the next question. So how does being overweight affect the kidney and bladder health? So yeah, this is a very interesting question. So overweight uh, definitely affects. So obesity is also one important predisposing factor for causing bladder cancer or kidney cancer. It also overweight or having a sedentary lifestyle uh, uh, causes the chances of causing kidney stones would be more because of the dietary habits, because of dehydration, because of not having proper food. So all these definitely tend to affect kidney and bladder health. So let's go for the next question, that is, when should men start getting screened for prostate problems? Yeah, so all the men who are over 50 years of age should get screened for prostate problems, being it enlargement of prostate or prostate cancer. So this screening can be done with simple tests like simple complete urine examination. First of all, a prostate examination by a urologist, urine examination, a simple ultrasound, and then a blood PSA, that's prostate specific antigen test, uh, which will help to screen your prostate. So, this is very important. So, coming to the next question. Can medications cause urological side effects like difficulty urinating? Yes, definitely some medications do cause urological side effects. Some medicines tend to prevent the bladder contraction and causes stasis of urine in the bladder and causes difficulty in urination, as well as some psychiatric medicines also tend to affect the bladder, uh, can also cause difficulty in urinating by affecting the bladder function, as well as communication by the response and communication by the patient himself who is taking those psychiatric medications. So, next question is, does long exposure to public toilets for urination affect women health? Um, so, if they are properly cleaned and well maintained toilets, usually, even though they are public toilets, they should not cause much of an effect. But improperly cleaned and very unhygienic toilets may tend to cause urinary infections. And as well as I already told in, previously, holding urine for longer times also tends to cause urine infections, especially in Indian women. So don't tend to hold your urine for a long time. Try to pass as soon as you get the sensation. So the next question is, why do females get more affected to UTI? Okay, so this is a bit of anatomical thing which is there in this to answer this question. Females, the urethra length. So urethra is the passage which carries urine from the bladder to outside. So the urethral length in females is very short. It's around 4 centimeters in length, whereas in males it's long. It's around 20 to 25 centimeters in length. So any of the urinary infections tend to easily, any of the bacteria, any of the infections tend to easily ascend up the urinary system in females because of the short urethral length. So they tend to go in and sit inside the bladder and then flare up or multiply from there on. So that's why females tend to get urine infections more than the males, and as well as the social causes like holding of the urine for a longer time in females also tends to predispose to urine infections more. So let's go ahead and see our next question. Do hormonal therapies cause UTI? Okay, so hormonal therapies as such shouldn't cause any urinary tract infections, but yeah, if they are immunosuppressive therapies like some medicines which tend to suppress your immunity, so these medicines can cause urinary tract infections because they tend to reduce the body's fighting ability to infections. So if there is any small predisposition to the urinary system, they tend to flare up as a urine infection. So that's when you develop UTI because of hormonal or immunotherapies. So I hope I have answered your question. Let's go to the next question. So the next question is, are frequent nighttime trips to the bathroom normal or a sign of something wrong? Okay. So frequent trip. So once one trip or once you go to the washroom in the night should be okay, provided you get to have a good sleep after that. But if it is more than twice, and if it's disturbing your sleep habits, then definitely that is something bothersome and that needs to be evaluated further. So, so especially this increased nighttime urination, medically we call it as nocturia. So nocturia can be caused because of diabetes, because of increased urine output in the nighttime, as well as obstructive sleep apnea. Few of them who are suffering from sleep apneas, who tend to snore in the night times, tend to have these nocturia or increased frequencies in the night. So definitely, if it is bothersome and if it is more than twice, you should definitely get yourself checked by a urologist. So let's see what's the next question is. So the next question is, how can I tell if my bladder issues are a normal part of aging or something serious? So any of the bladder issues like increased urinary frequency, if you tend to have any urgency to pass urine, if there is any hesitancy, like you don't initiate urination immediately when you feel the sensation, or you have difficulty in stopping the urination, all these are the bladder symptoms which we commonly see. When these are present, when these are seen in men above 50 years of age, then they should be okay. They should be aging symptoms. But keep in mind, you should definitely get your prostate checked. If you're above 50 years of age, prostate also can cause these symptoms. But younger people, it is unlikely to develop these symptoms. So if you are young, below 50 years, and if you're having these symptoms, definitely you should get evaluated. They are definitely not normal. So you should see what is happening with your kidneys and bladder health. So let's go to the next question. There is one viewer who says, Doctor, my urine color is light yellow. I want to the issue of problem. So light yellow is okay. That's a normal color of urine. Anything light yellow, pale yellow, clear urine is all normal urination. You don't need to be worried about that. So if your urination is something brown, then that's when you must be dehydrated. You should drink more water. Or if you see any reddish urine or slight pinkish urine, that's when you need to be worried, and then you should see a urologist. But light yellow is a normal color of urine. You don't need to be worried about that. So coming to the next question. Yeah. It's a viewer who asks how I can protect myself from cancer. Okay. So cancer is a process which occurs over a period of time. It is not a condition which just occurs in a day or in a month or so. So it's all overall health and lifestyle tends you to maintain, helps you to prevent from many of the cancers which occur. So that is again by maintaining proper lifestyle and healthy habits. Avoid smoking, limit your alcohol consumption, um, avoid tobacco chewing, exercise regularly, tend to avoid constipation, tend to have good home cooked food, avoid processed food, have a low salt diet and a low calorie diet. These are some common ones which help to common measures which help to prevent most of the cancers in the body. So let's go to the next question. Are recurring kidney stones a sign of bigger health problem? Yes, recurring kidney stones uh, is a sign of bigger health problems. So usually uh, kidney stones tend to recur once a patient or a person is suffering from precautions for kidney stones, to prevent kidney stones, like maintaining drinking good amount of water, avoiding foods which tend to cause kidney stones. Sometimes even any obstruction to your urinary passage can also cause kidney stones. So you should check whether your urinary system is obstructed or it's fine, and this also helps you to prevent recurring kidney stones. So I think that's the end of all the questions which we had, and I hope I have cleared most of your uh, uh, doubts, and hopefully uh, this information will help you stay safe and stay healthy and keep yourself active. Thank you.